Diarrhea, bleeding, stomach pain, urgency. These symptoms may sound common, but sometimes they point to colitis, which can have very different causes. When the colon gets inflamed, your body sends warning signs. The challenge is figuring out which type of colitis is causing them. Many people hear the word colitis and they think of ulcerative colitis, but infection, poor blood flow, medication, even microscopic inflammation can all cause it. Hello, everybody. I'm Dr. PK, and today we are talking about colitis. What is it? And different types, what causes it, how we diagnose it, and how it's treated. The word colitis simply means inflammation of the colon, which is the large intestine. But colitis is just not one single disease, it's actually a broad term. Some people get colitis from infection, some have chronic autoimmune condition like ulcerative colitis. Others develop colitis from reduced blood flow called ischemic colitis, and from a condition that only shows up under a microscope called microscopic colitis. In this video, I'm going to break it down. The colitis means the lining of colon becomes inflamed. When that happens, the bowel can become irritated, swollen. That can lead to diarrhea, abdominal pain, urgency, blood or mucus in the stool, fatigue. But the key point here is the treatment depends completely on the cause. That's why the proper diagnosis is important. Ulcerative colitis is one of the most well-known form of colitis, type of inflammatory bowel disease, IBD. It causes inflammation and ulcers in the lining of the colon and usually starts in the rectum area and then it spreads upward through more of the colon. And the common symptoms are bloody diarrhea, rectal bleeding, abdominal cramping, urgency, fatigue, weight loss in more severe cases. It's really chronic condition, meaning it tends to come and go in flares and remission. Infectious colitis. This type happens when colon becomes inflamed because of infection, bacterial infection, viral infection, sometimes parasitic infection. Common bacterial causes are Salmonella, Shigella, Campylobacter, and C. difficile, especially after antibiotic use. It can cause diarrhea, fever, cramps, and sometimes blood in the stool. This form may be temporary, but some infections may become serious, especially in adults and people with a weak immune system and those who become dehydrated. Ischemic colitis happens when blood to a part of the blood flow to part of colon is reduced. And this can happen from narrowing of blood vessels, low blood pressure, dehydration, other circulation-related problems. This often causes sudden severe abdominal pain, tenderness, and urgent need to move the bowel and bloody stool or rectal bleeding. It's only seen in older patients. Microscopic colitis is interesting because the colon may look normal during colonoscopy, but under the microscope, there's inflammation. And this condition often causes chronic watery diarrhea, bloating, cramping, weight loss in some cases. It is called microscopic because the diagnosis usually depends on biopsy samples taken during colonoscopy. Other causes could be radiation, medications, and so again, colitis is a syndrome, not just one diagnosis. The causes vary depending on the type. For ulcerative colitis and other inflammatory bowel conditions, experts believe cause involves a mix of immune dysfunctions, genetics, environmental factors, disturbance in gut microbiota, and a family history. For infectious colitis, cause is exposure to harmful organism, contaminated food, poor hand hygiene, or disruption in gut bacteria, such antibiotic use. For ischemic colitis, risk is usually blood flow compromise, vascular disease, low blood pressure. Microscopic colitis, exact cause is not clear, but immune factors and sometimes medications associations are thought to play a role. Can this be prevented? Can colitis be prevented? Prevention depends on type. You may not be able to fully prevent autoimmune form like ulcerative colitis because they are not simply caused by diet or stress alone, but good long-term disease control, regular follow-up, having a good gut hygiene, avoiding known flare-ups, known flare triggers may reduce complication. Healthy balanced diet and good hydration is very important. To reduce infectious colitis, gotta wash your hand well, use safe food handling, drink clean water, use antibiotics only when needed. To reduce ischemic colitis, hydration is very important. Maintaining blood pressure is very important, and controlling cardiovascular risk factors like diabetes, cholesterol, high cholesterol, and smoking. And diagnostic test usually, when someone has suspected colitis, we usually start with a history and physical exam, ask about diarrhea, blood in the stool, abdominal pain, fever, recent travel, weight loss, antibiotic use, family history. Blood test, we look for anemia, infection, inflammation, dehydration, electrolyte imbalance. Stool test, they are very important to rule out infection, including bacterial causes, and sometimes C. difficile, parasites, or markers of inflammation, like calprotectin. Colonoscopy or flexible sigmoidoscopy allows a doctor to directly look at the lining of the colon and collect biopsies. It's one of the key tests for diagnosing ulcerative colitis and microscopic colitis. Imaging. CT scan may be useful in some situation if the doctors are worried about severe inflammation, complications, or ischemic colitis. And this is an inference based on the diagnostic pathway commonly described for colitis evaluation and ischemic colitis assessment. For management, infectious colitis, IV fluid, rest, antibiotics maybe, correction of hydration. For ulcerative colitis, the goal is to control inflammation and induce remission and maintain remission. And the treatments include, of course, aminosalicylates, corticosteroid for flare-ups, immunomodulators, biologic or advanced therapy in some severe cases, sometimes even surgery. Microscopic colitis, avoiding trigger medication, diet adjustment, antidiarrheal treatment. Ischemic colitis, bowel rest, IV fluid, treatment of underlying causes, and close monitoring. Sometimes those patients need hospitalization, and sometimes even they need surgery if there's just serious damage to the bowel because of poor circulation. Avoiding unnecessary NSAIDs or irritating medication. Monitoring for bleeding, weight loss, fever, severe pain. Red flags, when to seek urgent care. If there's a heavy rectal bleeding, severe abdominal pain, high fever, fainting, dehydration, tachycardia, persistent nausea, vomiting, confusion, weakness. So the big takeaway is this: colitis is not one disease; it's a term of inflammation for colon, and causes could be autoimmune, infectious, microscopic, ischemic, or medication related. Symptoms usually overlap. Treatment is different for each type. That's why proper diagnosis matters. If you found this video helpful, share it, repost it, and subscribe to DrPKLyfe. And I will see you in next video. Thank you for watching.